Well, starting the warfarin, your doctor will advise you on the starting dose. The usual starting dose for a patient who's a little bit older is 5 milligrams a day. And then your doctor will order blood tests for you called an international normalised ratio, or you'll know it as an INR. And that INR testing will inform the doctor about what the next dose should be. And generally the INRs are done every couple of days initially, and then every 3 days, 5 days, as the doctor perceives as necessary, and eventually it will go out to 2 or more weeks once things are stable. So it takes a while to get stable. You should pay attention to the information that you're given. A lot of that will be found in a booklet you'll often be given when the drug is prescribed, which is a diary showing you both your doses and your INR levels. But that small booklet also contains some diet information. There's a bit of diet information to consider. The inconvenience of warfarin is the blood tests and the diet changes, if they're required. Now, everyone remembers the dark green leafy vegetables contain vitamin K, and vitamin K interferes with warfarin. However, there's more things that you can eat that contain vitamin K and can interfere with it. The good thing is that if you are having a change in your intake of vitamin K, we'll be able to pick that up in the INR test. We can actually tell whether it's affecting things. So that's the advantage of the blood tests. However, one of the things that you might want to do is make a list of the things that contain vitamin K that you like to eat, and make sure you have some of that every day. And if you can't get those things, make sure you've got a little list too of a few other things that contain vitamin K that you might also eat instead. Some people take the view you shouldn't be eating vitamin K. I take a different view. It's actually probably better and more stable for you to have a decent serving of the vitamin K food that you like each day, or one of its backup doses. So keeping the vitamin K level relatively even is what we need. We don't need you to avoid it. The problem if you avoid it is you might inadvertently, without knowing it, take in a big dose of vitamin K next Wednesday because you didn't realise it was in that food, and then you've inactivated the drug. So you're far better off to be taking some all the time. And a lot of the advice to stabilise you in the first few weeks should be around diet, rereading the booklet about that. You also must remember that if you start some antibiotics or new medication, you probably should go back and get your INR tested more frequently for a little while, because during that time there may be an interference between the drug you've just started, particularly a drug you're only going to be on for 10 days or something, and your warfarin. So you should be advised that whenever you get an illness where you might be vomiting or having diarrhea, so you might not be absorbing your tablets properly, you should get maybe an INR every couple of days during that time. But also you probably should be doing something similar if you introduce a new drug, and that doesn't just include one from prescribed to you. If you decide to take some new supplement or alternative medicine, you should get your INR done more frequently, because sometimes it's hard to predict what effect it will have on your blood thinning. This is all about keeping the blood thinning in the right area, because if you're in the right area 70% of the time, then you realise all of the benefits. 60% reduction in stroke and 30% reduction in risk of death. And if you were a diabetic, you'd be doing all of these things too. So you should look at atrial fibrillation a bit like diabetes. It's got some implications for your diet and for your monitoring. You monitor it with an INR, and you've got to make some dietary compromises if you're using warfarin.